Hi, everyone. My name is Sharon Ann Lynch. I'm with the O'Neill Institute for National and Global Health Law. I am a senior scholar that is working with a number of colleagues at UC here, as well as many civil society representatives and activists to launch and relaunch the TB Aims campaign. TB Aims is a time-sensitive, concentrated campaign that intends to increase the ambition, the implementation goals, the financial goals, and strategy reflected in the Global Fund proposals for TB in this next window. Now, many of you are working actively, engaging government, reviewing your national strategic plans, and hopefully engaging the CCMs. I hope as well that many of you are actually sitting on the CCMs because, as we're going to hear from Luchika, one of the horrible gaps in our response to TB is having enough civil society representatives carrying the torch for people with TB, people affected by TB, people at risk of TB into those CCMs. So what we have today is a webinar with a number of experts. So first of all, we'll be hearing from Luchika Ditu, who is the Executive Director of Stop TB Partnership. Luchika is the impetus for this campaign after her observations and direct engagement with many CCMs around the world and looking at the trends of the Global Fund proposals for TB over the years, where it's simply not keeping up with the epidemic, both in terms of the scale and the pace. Secondly, we'll hear from Celeste Gracia Edwards, who is the TB and HIV advisor at the Global Fund. Celeste will be walking us through the 13 program essentials. Those are the items that the Global Fund insists be reflected in the Global Fund proposals for TB and that countries report on progress. Thirdly, we'll hear from my dear colleague, Amanda Banda, who is an advisor with the O'Neill Institute. Now, Amanda is one of the pros out there in terms of being able to influence the country coordinated mechanisms for the better. And she's been working with activists around the world to try to influence the ambition and increase that ambition. And where that starts is in data literacy. What is happening now in countries, what could be happening now in countries, and what were the trends before from the previous Global Fund round. Finally, we're going to ask Dr. Jen Furin, who is a TB polymath, Jen, about some of what she's heard and to give us the clinical evidence and the impetus for why some of these new medical innovations and the long neglected interventions need to be scaled up and reflected in the TB proposals. Jen will also be taking some of your medical questions, as well as we have Carol Mitnick from Partners in Health, the famed epidemiologist working on TB for a couple of decades, who can respond to questions as well. So we've got the Global Fund Stop TB Partnership, O'Neill, and then we would love to hear from many of you. We've blocked out an hour and a half for this call, mainly the last half hour for questions and answers or any comments that you have. So first, I'd like to hand it over to Luchika for her opening remarks. Thank you, Luchika.
Good. So thank you, Sharon. It's always a big pleasure to be here. I'm happy to see 80 colleagues in attendance. It's also good to start and have these conversations and hopefully backed by a lot of action in this very important moment, because basically if it's not happening now, between now and I would say even July, August, this effort, then the next time we can do it will be in 3 years, right? Because this is about the locking down the applications for the Global Fund for the current funding model. And this for TB, this is a huge opportunity because, as you know, our resources are very limited. Global Fund is fortunately or unfortunately the biggest external donor. Making the money work from the Global Fund and putting smart investments in there and pushing for the newest tools and for applications that include a comprehensive package going forward to the Global Fund will be essential. And my points are on two directions. One is, as Sharon said, what we know so far And we are going to look into a very systematic manner in a few of the in several of the high burden countries, the CCM representation of people with TB knowledge, not even only civil society and communities, but in general, is extremely limited. And out of usually 20-something people that are in the CCMs, usually what we hear is maybe 2 are having some TB knowledge, out of which maybe 1 is a TB survivor or a TB civil society. And this is an area very important. Basically, you can have fantastic applications if they are going to be evaluated or discussed in a CCM that has 0 TB knowledge or 0 understanding. And we heard of situations in which discussions around new tools that were taking a lot of time, but then people couldn't understand and they were taken off the application. Because it was difficult to really comprehend how things are coming together and why are needed certain type of treatment regimens, which are shorter, but maybe slightly more expensive than the previous one. And, you know, all these crazy discussions for several of us, but happening at the country level and usually happening with a group that is not informed, you know, is not that. So one piece is that. The other piece, just to make this very quick, so one piece is the CCM's representation. And always, if you can, in the countries where you work, we are trying from Stop TB and pushing as well. And as I said, we will look into exactly how this stays, but look who is in the CCM to defend or to even understand the TB components, right? With whom this dialogue is happening, and especially the representations of people affected by TB and civil society and TB survivors and communities. Because as you know, we have a lot of organizations at country level capacitated now to receive the funding and to be partners in the Global Fund processes. So we need to make sure that they are either in the CCM, either empowered to apply and so on. The other component is very important, maybe more important than the CCM composition, because it's actually about the work. And it's about the fact that very important is that the countries come with to the Global Fund with applications that are comprehensive, that include a package that look at the entire cycle with TB and what should be offered to every person affected, especially the most vulnerable, that should have access to the best tools, to the best WHO recommendations, to the best diagnosis, preventive and treatment regimens. And that will indeed generate an application that will be very expensive, but good for that, because then there is this possibility of having some interventions in the funded and then in the unfunded quality demand. And it's really not a problem at all to have things in the funded demand and then things in the pipeline, to say so. For the unfunded quality demand, some money are being becoming available throughout the implementation cycle. There is portfolio optimization. The countries that were smart enough to have an unfunded quality demand, a robust proposal in which they said, okay, our aim to end TB should include these interventions, and we want to make it for everybody, and we want this and that, and it will cost us a lot. And we have an allocation that is small, so we had to prioritize. But we have this pipeline here, and we can come with it the moment that things are becoming available. And unfortunately, not all, very few countries actually on TB had unfunded quality demands, had a pipeline of requests that need to come, and very ambitious views in terms of offering services to all the people that are in need. The last thing that I want to say is that it's difficult to say somebody is guilty or so. It comes from the fact that in TB, the funding used to be very limited. And I think it's, I should say it is still very limited. And it came just from the government and the Global Fund. With some, thank God, inputs, USAID was the only one that was adding some extra there, but very limited. When you have very few money, and you go year after year like that, you become very shy, very restrained, very kind of, yeah, I don't think it's going to happen, you know, very discouraged. And rather than speaking for the people you serve, you start saying, well, it's impossible. So we need to nurture that. Yes, it's possible, because it's much easier to push for funding if you have a plan and an ambition and you believe in it. Because if you just go with low, you will always remain low. And the last point, really, before Sharon kicks me out of here, I want to say is that, you know, when India decided or had Prime Minister Modi calling for ending TB by 2025, people rolled their eyes. People said it's impossible. And I have to say that I don't think they will end TB by 2025, but that triggered several things. I'm not going into the details of the many things that triggered, including a lot of research and development, but I'm going to refer to something that is linked to this. It triggered the Minister of Health to stay with his team and civil society as much as they could have been at that time to discuss what it means to end TB in India and make a plan. And it costed huge. I think it's 3 billion a year. But in the first year, they doubled their budget. And in the second year, they tripled their budget. It's not enough. Okay. And in India program, there are many holes. But they had the thinking and the plan of a comprehensive package, including preventive treatment, including testing for infection, including obviously diagnosis and scale and and how much it costs. So without having a thinking around what is a comprehensive package of TB interventions that we need to put in place in our program, how will we deliver that and how much it will cost, we can apply to Global Fund with small pieces till 2050, but we will not end TB. So for that, we need your energy and push on these two arms, to say so, in passing the messages and the components that are needed, that I know Celeste and Jen and Carol and obviously Sharon and the team will speak about. So thank you so much.
Thank you so much, Luchika. Appreciate that, as well as your inspiration for this campaign and your support of so many of the civil society representatives who are on this call through the Challenge facility. I see that James Millar is on as well. So thank you as always for supporting civil society groups working on the ground. So over to Celeste Gracia Edwards, who again is the TB HIV advisor at the Global Fund. So these are the 13 program essentials. And so this gives those of us on the call the mandate, the impetus, the leverage to go into those CCMs, to go into the negotiations with government and other representatives on the CCMs and make the case for scale up of these program essentials. So Celeste, over to you, please.
Thank you very much, Sharon, and good morning and good afternoon to everyone there. Can we have the slides up, please? I cannot see the slides. Can you see them?
No, not yet.
Not yet. Okay. Well, in the meantime, I'm going to start telling you how the program essentials came about and what they are. So the program essentials, they are being introduced for the first time now in this new cycle and grant cycle number 7. And they are being introduced for HIV, for TB, and for malaria. And these are approaches that we think are going to help us reach our collective goals. Countries are going to be able to reach their goals, and we think also the collective goals that we have as a community. Next slide, please. I think that the most important part that I have to say about the program essentials is that they are not randomly selected. Yeah, they were selected because they are based on evidence. They are based on recommendations by technical partners. So they are based on WHO recommendations, Stop TB recommendations, and if you look at them, you are going to recognize them easily and realize that they are already in many guidelines, some of them for many years. We think that the program essentials are important because it's about equity. It's about making sure that we have access for everybody, not only in small pilots in small parts of the country, but that everyone has the same access. We think that once we manage to implement our program essentials, we are going to be on our way, or we are going to be able to reach our goals. Next slide, please. So you can see that we have overall, we have 13 program essentials, and they are divided in 5 different parts. The first one is TB screening and diagnosis. And for TB screening and diagnosis, the first one, we are talking about systematic TB screening that is provided for those at highest risk. This is based in the latest WHO recommendations, and we are encouraging as well, not only the questions for TB screening, but also we are encouraging the use of digital chest X-rays with or without artificial intelligence as well. Yeah. Then the second one, it's about the use of rapid molecular assays as the first diagnostic test. We know that this has been a recommendation for many years, 10 years more or less, but we have not seen an advance in this. So what we are asking is, we know that this is not something that it's going to be easy and easily implementable from one day to the next, but at least for the country to create a plan to achieve this and to use molecular diagnostics such as GeneXpress or TrueNAT as the first diagnostic test. Yeah. Then number 3 is for all people that have TB to actually have access to testing for further resistance, because we don't want to have diagnosis of MDR that is coming late or of XDR that is coming late. And then we have number 4, which is to have a TB diagnostic network that is functional, that is connected, that has maintenance, that has quality assurance, that there is biosafety for those that are working there, and that we have appropriate maintenance and specimen transportation. Yeah, all of these are based in WHO recommendations. Then we have number 2, which is TB treatment and care. And here you will see one is for children, and specifically we see that children are often neglected, and we don't see that they are using child-friendly formulations, even though they are available. It is based on WHO recommendations as well, and we are encouraging all oral regimens for treatment of DRTB and the 4-month regimen for non-severe DSTV for children. And then we have the other point, which is 2.2, which is for DRTB, which is the switch to shorter all oral regimens for treatment of drug-resistant tuberculosis. Then we go to TB prevention. For TB prevention, we are encouraging not only TPT for people living with HIV, which is what mostly happens in countries, or only TPT for children under 5. We are thinking about all household contacts. So this is how we are going to be able to reach our goals and TB. We think that we should also be encouraging the use of shorter regimens, such as 3HP, 1HP, or 3RH, and we strongly encourage that as well. Next slide, please. For TB HIV, we are seeing still that a lot of people are not being initiated on antiretroviral treatment. So we are encouraging as well initiation early, 2 weeks as per WHO recommendations. Then we come to the cross-cutting areas, which are the parts that are all-encompassing and does not make them any less important, which are to have a digital case-based TB surveillance system. Yeah. Then to have the NTPs to have the capacity and the will to do cascade analysis throughout the pathway of TB care, so that they can make informed decisions on where to invest based on where they are having their gaps. Then the engagement of healthcare providers. We know that a lot of countries, patients are mainly going to access healthcare via private providers, and we are missing the diagnosis and we are missing those patients, and we want to make sure that we are engaging with them and that we are working with them. Then number 4 is the decentralized and ambulatory and community and home-based care people-centered services. We think that people should only be hospitalized for TB if they require so, that it should not be something that is the way that treatment is provided, that treatment should be provided also closer to the patient's home and in a way that is easily accessible. And then, of course, we have the other one, which is that all TV programming must be human rights-based, gender responsive and informed, and responsive of analysis of inequities, and include stigma and discrimination reduction activities for people with TV and affected populations, that there is legal literacy and access to justice activities, as well as support to community mobilization and advocacy, and community-led monitoring for social accountability. So all of those are based on evidence. They are based on WHO recommendations or recommendation of other partners. They are not controversial. There is evidence behind them, and that's why they were chosen. And this is why we want to emphasize them for the next grant cycle. Next slide, please. So how are we going to be have the program essentials be used the grant cycle 7? So first of all, the countries will have to see what is their baseline, what is their level of advancement, where are they regarding the program essentials. Then this will have to be discussed via country dialogue as well. What are the actions that are going to be needed so that we can make sure that these program essentials are included in the funding request, yeah? And then out of these program essentials, which ones are we going to be able to actually put them inside the funding request? Then the process is going to continue the same way it is, which is going to be part of the funding request. The funding request is going to be evaluated by the technical review panel and GAC review as was in the past as well. And then we are going to, the Global Fund is going to monitor the program essentials the same way we monitor everything. So there is no extra work that is going to be added for the monitoring of this. There is one part that is very important that I forgot to tell you, which is that the program essentials, we know that we are not going to be able to fund them 100%. So we are encouraging the other funders as well to step up and to fund program essentials. We know that sometimes the allocations that we have are not going to be enough. So that is why we need other partners, and we need the national government to also support some of them. Next slide, please. So this is an example of how an essential data table, which is the baseline assessment, looks like. So every country, when they submit their funding request, they have to submit this essential data table. This essential data table, what tells us is where the country is at the beginning of the grant. So they will tell us, does the country has a policy related to TV screening? Is this policy in place? Yes or no? As you can see in this example, this country has the policy in place, but they are not having good implementation. They have implementation in less than 50% of the sites. Yeah. So this is how we are going to be seeing this. We are going to have this baseline assessment, see where the country is not doing well, and this will have to be discussed during country dialogue to decide how are we going to best support. Next slide, please. As I was saying, once we have this baseline assessment, this baseline assessment should be used to be presented during country dialogue. And then during country dialogue, there are a few questions that have to be asked. So now that we have this baseline assessment, where do we want to be in 3 years' time for each of the program essentials? Where does the country see themselves in 3 years' time? What are the bottlenecks that we are having that are not allowing us to improve and to reach 100%? And then what are the gaps that we are identifying? Do we need extra technical assistance to address this? Do we need something extra to this? Then also to make sure how we can make sure that this program essential is equitably implemented to all relevant populations throughout the country. This is to make sure that, again, this is not only a small pilot, this is not only a small amount of people living in the capital, but that all relevant populations have access, including people that are in prisons. Then how could countries incorporate the program essentials into routine activities? Maybe embed them inside the supportive supervision that you are having, yeah? Then how can partners and stakeholders say, okay, we are going to support this part of the program essentials, as we are not going to have the capacity to put it all under the funding request, yeah? And then how is the country going to monitor this? One of the things that we think is that this essential data table that I have just shown you as a baseline, this is something that could be repeated easily in 1 year time, 2 year time, so the own national TV program can see if they are advancing or not regarding those program essentials. Next slide, please. Here you have an example of a country of what they did after they had this essential data table field and they presented it to the country dialogue. And then they decided, okay, this is the systematic TV screening. This is the first program essentials, how we are going to monitor it. And they have chosen 2 indicators, yeah. And then they have a baseline, yeah, of where they are and where they created targets or where they want to be by the end of the next grant. And then they started discussing what are the activities that they need to get there. So first of all was to revise the screening and diagnostic algorithm and check a screening followed by molecular diagnostic tests, active case finding among key and vulnerable population, intensified case finding in health facilities by digital chest X-ray, and artificial intelligence and TrueNAT, and use tool samples for diagnostic of TB in children. We have developed a toolkit, yeah, that we are circulating already to country teams and that we are going to be uploading to the Global Fund webpage that is it can be used by the NTP to identify which indicators are best related to the program essential so that they know how to do this exact same exercise. Yeah. So you can see each program essential, what is the baseline, and then where they want to be in 3 years' time, and what are the priorities that they are going to be adding to their funding request. Next slide, please. Here you can see what I was saying before about the discussions, what is going to happen. We have all the program essentials, and then we have all other eligible TV interventions that you're going to have to discuss them during country dialogue. After that, then it's going to decide, okay, since we cannot fund everything, some of them are going to end inside the funding request. Some of them we are going to be putting under PAR so that if we have extra funding, we are going to be able to support this. So it's very important that to consider PAR as an integral part of the funding request, and then also to decide which ones are going to be funded via other partners. Yeah. Next slide, please. This is more or less what I have been saying until now. So first of all, you have the baseline assessment, discussion during country dialogue, deciding which of them are ended up in the funding request. In the funding request, you are going to have the essential data table field, which is the baseline assessment. You're going to have to write in the narrative what are you going to do with the ones that have not been addressed? Yeah. The program essentials that have not been addressed, and this is going to be for high impact and core countries. And then during grant making, we are going to, well, first TRP is going to evaluate the funding request as it does always. Then when it goes to grant making, is just to ensure that the program essentials end up being part of the grant, and then that it's monitored like it regularly is. Next slide, please. So these are some frequently asked questions that we have for program essentials. So the first one is, must countries use global fund grants to address or make progress toward achieving program essentials? Not necessarily. Like I was saying, the global fund can fund, but we don't have the capacity to fund all the needs. So some of them are going to end up in the funding request. Some of them are going to end up under PAR in the funding request, and some of them will have to be funded via other sources. What happens if a country disease program does not fulfill the program essentials? We know that this is not something that we're going to attain from one day to the next. We know that it's going to take some time, but we think that it's important to use this opportunity to discuss and start a conversation of how we are going to get there. Yeah, what are our targets? How are we going to go from red to green? How should countries use program essentials during country dialogue? So this is what I was saying. You have your essential data table, which is the baseline assessment. You can see, do you have a policy in place? Do you have this implemented in facilities in more than 50% of the country, yes or no? How do I create a policy? How do I implement this? So we think that it's important that you use this essential data table and go one by one with the program essentials to see how you can attain them, how you can reach them. Will progress against program essentials be tracked throughout the grant cycle? Like I was saying, we are going to have our indicators that we use regularly to monitor our grants, and they're going to be there. There's not going to be any extra effort. But we think that, for instance, this baseline assessment, this essential data table, can be used to be followed for NTPs to follow how the implementation of program essentials is going. So this is an exercise that could be repeated. The filling of this essential data table and baseline assessment, it can be done yearly or every 2 years to just see how the progression is going. And the other question is, are there any program essentials for RSSH? No, there are not program essentials for RSSH. They have something that is similar, that is called critical approaches, but they are different from the program essentials. And you can find more information about that on the RSSH information note. Next slide, please. So program essentials, as I was saying, they are not only for TB, we have them for HIV, for TB and malaria, and you're going to have more information about that in the respective information notes. Yeah. Then you have also the modular frameworks. In the program essentials are embedded inside the modular framework. There is no module specific for program essentials, but all the relevant activities and interventions and indicators are there. Then you have also the applicant handbook that explains and gives more information on program essentials. All these documents are being translated, are translated already, and they are also in the Global Fund webpage. During the talk, I have mentioned as well that there is a TB toolkit for program essentials, that this has been developed and it's being disseminated, and it's going to be soon in the Global Fund webpage as well. And in that toolkit is basically how to appropriately fill this essential data table and do a correct baseline assessment, how to use it during country dialogue, and how to create that slide that I was showing there of how to go from the program essentials to what are the prioritized activities that we are going to put in the funding request. That will be all. Thanks.
Celeste, thank you so much for that. I just want to flag two things. People have raised in the Q&A the gap that TB-LAM is missing. So would you like to respond to that?
Yes, we are not saying no to TB-LAM. We are saying, please, these are the program essentials, but you can go further. There are other TB recommended interventions, and we are very much in support of TB-LAM, and we want to see it in the funding request. It did not make one of the program essentials due to the fact that we had a limited number of program essentials, so something had to give, but it does not mean that we are not supporting it. We are in very much support of TB-LAM, and we're looking forward to see it in the funding request and grants. Thanks.
And before we hear from Amanda, I just want to second that. TB-LAM is US $2.50 for most countries, the price of a toothbrush. It is both one of the simpler tools that we have and one of the most important. It should be in every primary healthcare facility, given its importance as a diagnostic tool, especially among people living with HIV and the lower CD4 counts. So thank you so much for Celeste. And also, I just want to respond that the slides, both the English and hopefully, Celeste, if you can get us the French version of these slides or the PE slides, thank you so much, will be are available now in the link that I've been putting into the answered questions,
Yeah, you
along with some
have
other
them.
Resources. Please.
You have them, sorry, in the information notes. In the information notes in French, it's available, I think, in French and Spanish, and you have the program essentials there described in both languages. So I will send you the link to the information notes.
Wonderful. Thank you. And also in the link that I've been providing, you can find the info note, the English, but we'll add the French and the Spanish, so you can have one place to go for some of this information. But obviously, the Global Fund website is full of useful information, and Amanda will be walking us through some of that information. So, Amanda, can we hear from you now, both in terms of telling us a bit more about what we need to know about the funding cycle, as well as some strategies to influence those proposals. And of course, if you don't mind introducing yourself, Amanda. Thank you so much.
Thank you so much, Sharon, and thanks a lot, Celeste, for the presentation. My name is Amanda Banda. I am in this webinar in my advisory capacity to the O'Neill Institute, but also just as a matter of declaring also conflict of interest that I am working for the Global Fund, Community Engagement Strategic Initiative. And so what I would like to share is pretty much a follow-up on what Celeste has presented, but also just breaking it down, especially for the communities in terms of the step-by-step, like, how do we move forward? How do we engage from here? And where do we start? And what do we need to look out for as we engage in the process? And also many of you being really amazing advocates out there. I think that some of this will sound familiar, but I think that if I'm to give like a key takeaway message in the start, I think the secret is like, as you engage in the Global Fund Grant Cycle 7, really draw on your advocacy strategy skills and really come to the table with, this is what we want to engage, like a proper strategy, the what's the issue, and who are the stakeholders around the table, and exactly what are we going to do, to influence them, to ensure the outcomes that we want. So just briefly on the TB Aims campaign, if you can move to the next slide, please, is really trying to push about 15 priority indicators in the Global Fund Grant Cycle 7. So I'm not going to go through most of them, but I think that a lot of it also has been covered by Celeste. And we have on the screen just what those are. So it's the reduction of TB deaths. We know that in most countries, this is not going down. The incidence, I think we know all the data very well from the global TB report that was released in November last year. And also country by country data is showing us that there's quite a lot of challenges. Diagnosis is a problem, and we know that also pediatric TB is still way behind, and also treatment for drug sensitive and drug resistant. And we just spoke about TPT and TB-LAM. And I think that Luchika also mentioned the issue around, CCM, civil society representative from the affected communities. Next slide, please. In terms of coverage of the number of countries that are engaged is Bangladesh, Malawi, Kenya, Mozambique, Nigeria, Uganda, Pakistan, PNG, Philippines, South Africa, Tanzania, Zambia, and Zimbabwe. And this does prioritize the list of the highest and high TB burden countries, but also really looks at the geographical spread and focus, but also complementarities to what communities are doing in those particular contexts. So next slide, please. So in the next slide is just an overall, and this information, you will find it. I think I will share links to where you can find A lot of this information is just an overview of this cycle. And starting with the national strategic plans, I think we often kind of like not neglect, but I think just a reminder that very important that you engage in the national strategic plans as you plan to engage in the Grant Cycle 7. That's pretty much going to be the basis. I think for a number of the indicators and a number of the ambitions that the countries will be making, most of it will already be articulated in the national strategic plans in terms of what are the targets in the coming years that they want to achieve and where the countries are at. But also the level of ambition of where they want to push. And I think when it comes to engaging in the Grant Cycle 7, I think the key question is then what's going to be taken up in terms of support in implementation by the Global Fund, and also recognizing that besides Global Fund, there are resources from other funders, USAID. I think that the governments themselves are also financing the scale up of the TBMs. So this part is just relating to what you can do as you engage in the Global Fund Grant Cycle 7. So next slide, please. In terms of step number 1, I think is where do we start? You know, very important as communities, as civil society, that you from the very start, you know, have a roadmap, an engagement plan, that you just get organized. You know, who's going to lead the coordination? In a lot of countries, there are already existing structures and leading advocacy networks and groups. Are these going to lead the engagement in the Grant Cycle 7? And who's doing what, and ensuring that you are not leaving anybody behind in the process? Who's going to be your focal points? Is it going to be the CCM reps in the process, or are there other leading networks that are also going to lead this process, and how are they going to coordinate? And how are you going to communicate with each other at country level? Very important to know that you will go far working together and coordinating and collaborating with other communities that are working and engaging in the TB space than if you do just engage alone as a standalone community. And also, I think part of the constituency roadmap or engagement plan is also how you will engage with other communities, malaria constituency, how you will also engage with the HIV constituency to ensure that you raise awareness about the TB priorities, but also that you are coordinating collectively then as civil society in the processes. Next slide, please. So very important, like I said earlier, that you're approaching this from the advocacy strategic perspective. And I think you all know that before you embark on any advocacy campaigns and strategy, the first thing that you need to be very clear on is the what. You know, what is the issue, and where's the evidence, and where is the data? Celeste, I think, spoke a lot about you know some of the issues that you might want to look at, but most of you will be asking, okay, we are not experts at this. Where do we start, and where do we find data, and how do we know you know, what's going on around implementation of some of those targets that I've mentioned? I think there's no like right way or wrong way in terms of how you're gonna go about this, but I think that these are just kind of like some pointers in terms of where you might want to go to get some idea of what the program looks like at the moment. So first of all, I didn't add it here, but I think that I just mentioned the national strategic plans, that most countries before they embark in this process, they will be updating the national strategic plan, and they completed strategic plan will have quite some good source of data and information in terms of where the country is at, and also what are the ambitions that it's making. But if you go back to NFM3 program data, you will also find some very good information there, you know, around what was planned in the previous grant cycle and where the country is at. Most of the countries, after the allocation letters have been disseminated, they will also have their own roadmap. And part of those conversations that will be happening, and part of the meetings and data that will be shared, is how the country has up-to-date performed on the NFM3. And there will be program data or program review meetings that will be taking place that you might want to attend and understand, where the country stands. And also very important that you will find on the Global Fund website, there is a performance framework that was also submitted with the previous grant cycle. That you might also want to have a good sense of, what were the targets, what were the ambition, what were they trying to achieve in the previous cycle. And so as you engage in those meetings, you would be thinking, okay, why have we not achieved this? And if we have achieved, what have been the success factors? But if we have not, what's really going on? And you really need to be asking those questions, but also then how and what are the ambitions that will be set, in the grant cycle 7. Most countries also have their own data that they are collecting, robust data that is updated in most countries almost every quarter. You might also want to consult that and find out how is TB programs doing and what is it saying about the specific issue that you want to prioritize and influence in the grant cycle 7. And also, of course, the CCM's regular review meetings, program performance, there is data and information that is shared about, implementation status of the programs. And also, of course, most of you are engaged in community-led monitoring, but also doing a lot of community consultations or do plan to do community consultations, focus groups, the experiences of the communities themselves as they try to access care. I think it's also a very important source of, information about what are the real issues, what are the real gaps, and what needs to be done. I've put UNAIDS data here because of the co-infection. I think for some of the data indicators, you might find some very good data there. There's an annual report that's published that also does have country by country breakdown of what's going on. The Global TB report, Stop TB Partnership, has country profiles also on their website where you can find. And the Global Fund has quite a lot of data as well. If you link on the slides, we will share this. You can find a lot collection of the previous applications. You can find a lot of the essential data that they have put together to just help the countries do their submissions. And also most of these has already been shared with your CCM along with the allocation later. So also find out from your CCM reps to share with you all that information that has been shared, because there's quite a lot of key and important, very useful information that you can use. And I'm sure that after looking at all this, you should be able to have now a good sense of where your program is at and what are the issues. And from there, you now identify a list of priorities that you will try to influence in the process and be very clear. For example, that at the end of the application period or grant cycle, the consultations and the engagements, we want to ensure that the funding request actually does include bold, ambitious targets, XYZ, and not just that, but that also that there is the corresponding budgets, to get the work done, because that's the most important thing. So now, as we move to the next slide, now that you have a good sense of your NSP and you have looked at your different data sources, you have established, what are some of the issues and what are some of the things that you might need to push. This is just an example of the many different data that's open and free and accessible on the Global Fund website. Next slide, please. So you have reviewed your you have seen what your NSP looks like and what are the ambitions. I think the most important thing is, like I said earlier, I think if I were to emphasize the key message from this webinar, develop your strategy. Like, I think don't take it simply that, okay, no, we know what we're going to do and we know what we're going to push. I think it helps to write things down, even if you're going to develop your one-pager advocacy influencing strategy. I think looking at your data, reviewing everything, you need to be very clear that this is what we want to push and this is what we want to influence. And by this much, because it's one thing to say, okay, we want to scale up the number of facilities, for example, delivering and supporting, for example, or TPT. I think you might want to be very specific that, we know from the data that we have looked at the moment that it's only 10% of facilities in country X that is delivering that particular service. And so your bold, ambitious goal or specific objective would be that maybe you want that number to scale up to 85%, because it's going to be very easy and very useful at the end of the process to also gauge and measure the impact of your advocacy in terms of, did you get to the 85% that you wanted, or you managed to achieve 55%? And if 55%, I think maybe that's a win-win. That's like a compromise. So you really need to be very clear. What is your specific goal? What is your specific objective? That is very smart, specific, and measurable. And so who are your target stakeholders? I think in any advocacy strategy, when you have identified your issue, now you begin to think who is going to help us achieve this. And so you really need to make sure that you have clearly articulated who are your targeted stakeholders that you're going to engage with to help you reach those objectives. And also, what are you going to do? Are you going to have meetings? Are you sending briefs? Are you sending memos? Are you preparing specific documents that you're going to use to engage with them? Are you going to call on other people that have influence on them to support you in the lobbying and advocacy? Are you going to make sure that affected communities are represented in all the Global Fund meetings, and that they're also very clear on the objectives, and that they're very consistent as well in the messaging and in the priorities that they're pushing there? And are you also going to make sure that you get a seat at the writing table in the writing teams, and that you are part of the process from the start to the end? And I think that most of you are experts at this, and how else and what else you would need to do to get those priorities in. Next step, please. I've already spoken about the national strategic plans and the importance of engaging in the national strategic plan, and also how you can use the national strategic plans targets, to put pressure, and especially when it comes to expanding, the targets, because maybe your national TB program might also be interested in scaling up drug-resistant TB, but maybe the targets are just not as bold as ambitious. But I think that you can go back to your national strategic plan as well to see what were the targets, what were the ambitions, and really try to push as far as you can. Next slide, please. So when you know your issue, you have a clear strategy, you have your data and the allocation letter. I think by now, this is February, most countries already received their allocation letters. All countries actually received their allocation letters in December. So you all should have this, you all should have seen this. And if you have not seen it, I think reach out to your other TB networks in the country, reach out to the CCM, reach out to the CCM reps. Civil society and TB community reps in the CCM to share. Very important. And just added also other information about, the allocation letter, what it is, what does it contain. You can find it online and just read up more about it. There's frequently asked questions there. But one of the things that I wanted to flag here is the matching funds, and most likely your allocation letter might contain information about matching funds. And just to flag, there is a lot of priority areas and topics that for TB, scale up of TB prevention is eligible for matching funds, but also finding and treating people with DS and DRTB is also eligible. And again, I've just put information where you can listen to more webinars and hear more information about exactly what are matching funds, but also how do we, make sure that we engage in the conversations there as things are being prioritized, and as the NTPs and the entire CCM are actually determining what gets priority and what within that is going to happen. So next slide, please. So the country dialogues, I've already mentioned, very important for your advocacy strategy, that you really are clear that either you are represented, you have representatives that are going to be part of the meetings, but also remember in the beginning I mentioned about an engagement plan and a communication plan. So not everybody who's affected and living with TB will be in the country dialogue meeting. Obviously, you're going to have representatives. Very important that you really prioritize. The context differ. In some countries, civil society communities do nominate who's going to be representing them in this process. In some countries, those are selected. The process is different from one country to another, but just make sure that the community reps that you're sending to be in the country dialogue, who's going to be attending those meetings, you know who they are, and they also know what the priorities that you want to push are. And also that you're not just going to engage there as communities, as civil society, but you need to make sure. My point is, in your advocacy strategy, I spoke about stakeholders. You also need to be aware of who else is around the table that can have influence. And influence, I think, means influence to get you what you want, but also influence to not get you what you want. And I think you need to be aware of both. And so be very strategic about, how you are going to engage with different levels and layers of influencers and institutions and organizations, and as well individuals, specific individuals in the process, to make sure that the priorities and the issues are coming out clearly. Next slide, please. I think you can move to the next slide. These are just like, the expected outputs of the country dialogue, but also here, just want to flag a few things in terms of the application package and things that might be really important that you do pay attention to. A lot of communities and civil society, our focus tends to be on the funding request document itself. So we have engaged in the country dialogues, and that's about it. And we have probably reviewed the funding request document itself, and that's about it. But we tend to skip on other very important information that will be submitted along the funding request. And we need to make sure that we are also keeping an eye and we are reviewing this, and that we know what's there. There's the essential data tables. Like I said, for some countries, I saw that when they received their allocation letters, they actually also got a copy of the essential data table, which I assume that will be updated and submitted as an updated version with the application. Very important, I mentioned the performance framework. These are the targets that the application is aiming to achieve at the end of the implementation period. And very important that you also have had a look at this and that you have actually influenced what are those targets. The programmatic gaps table is very interesting. I think I shared links, very important. You will see examples of previous submissions, what were the programmatic gaps that they had identified and even projected for the period of implementation and also beyond, will be very telling also about, what are some of the issues. For those of you that might also be interested in the domestic resource mobilization and also pushing domestic investment in TB, you also want to make sure that, you have seen the funding landscape tables. You have a clear, good sense of where's the TB funding coming from. And because as you're talking about scale up of targets and ambitions, the big issue is not so much sometimes that there's a lack of interest and the lack of ambition, but I think it's about the lack of resources. So you also need to be sure that you're also following up on the funding and who's funding, and that you're also engaging, because scaling up those targets and interventions will require resources, and not just from the Global Fund, but from your government, from other donors as well that are supporting TB programs in country. Very important and new in this cycle is the funding priorities annex for civil society. And you also want to make sure that you are part of the conversations, part of the broader civil society network. It will depend country by country, where there's joint submissions. There's expected that civil society jointly will also submit the funding priorities. And very important as well that you keep an eye and you're influencing the TB priorities in that document. And I think that the national strategic plans I've spoken about and the essential data table, I think is very key for me, and the rest of it. I think this is just to tell you that there's a whole lot of other information that will be submitted along with the funding request, and that you're not just paying attention to the funding request itself and that you're satisfied with that. Next slide, please. So actually you can move to the next slide because I've spoken already about some of these. And I think that once the funding request has been submitted, and there's a whole lot of process that happens, but I think just want to flag key is the technical review. This is an independent, impartial team of experts that's recruited independently to review what the countries would have submitted and really give feedback, to see how technically sound, but also look at a lot of other considerations about, how strong and robust the funding request is. And most likely they will send feedback to the country team, to the CCM, in terms of, what are some of the issues that they have picked in the funding request. Either maybe it's going to be great, this is a very strong funding request and application, we probably recommending it to go to the next process, which is grant making that I will talk about, or they might require or have a lot of questions that need a lot of response. And I think for most of you engaging at the country level, you know that usually either the CCM or the key, either HIV, TB programs will have a look at this and quickly respond and not engage civil society and send those inputs and feedback. And maybe some of the questions that might come back here could be really interesting and important, that you ensure that you have seen what the comments are, but also that you really try to engage as they send feedback, that you really also have tried to be part of the conversations and part of the table to what is that feedback that has come through, but also what is the responses from the country, because sometimes this is also where things begin to shift and to change. And also this is where I've seen that civil society begin to drop off the process, because most people think that once the funding request is submitted, the work is done, that's it, hooray, we can see the language in the funding request and that's about it. You celebrate that you have won, you have achieved something. But just to flag that the process doesn't end there, and that there are follow-up processes that you need to keep an eye on. So next slide, please. So in the next slide, this is the extremely important one. So above and beyond, like I've said, submission of the funding request, you want to make sure that you're part of grant making. You want to make sure that you're part of the negotiations around, specific budgets, around specific areas of intervention. I think one of the things that I possibly maybe have not mentioned is that as you develop your priorities as communities and civil society organizations, you also really want to make sure that you have a sense or an idea of the costing of those interventions, and there is technical support available. And I think you can reach out to Stop TB Partnership and others to really support you to try to get a sense of, what is this intervention that we're asking for going to cost. And I think, again, like I mentioned, your NSPs will also give you some good sense of projected costs, because most of the NSPs will come with a cost. And so you will get a good sense of, if this target, if this ambition is going to be achieved, this is how much money is going to require. And I think in the grant making period, this is also where we lose out on quite a number of interventions. So even if it might have been included as in language in the funding request, you will find that whereas the intervention to be successfully implemented, assuming would cost $25 million, when it comes to grant making, you might find that the budget is probably been reduced to $5 million. And there we begin to wonder, like, oh, we managed to get this in the funding request, but it's not being implemented, it's not being scaled up. I think it's because we probably had also slacked in terms of our engagement and keeping an eye on, the budget adjustments that might be taking place at this stage. And what's realistic, I think for me, that's the question in terms of, what's realistic to really even begin to reach the baselines that we want in terms of expansion. And so just to flag again that, you really also want to get involved in the grant making processes, that it's not over until you have a good sense of what's happening here as well. So I should believe that this is my last slide. This should be one more. You can move to the next slide. So I think in the grant making period is where robust civil society engagement possibly ends. The rest of it is, I would say, I use the word in advocacy, is above your accountability threshold, meaning that what happens here, I think, is no longer something that you can influence. I think where you end is in the grant making phase. This is where your funding request actually goes for reviews and approval, and it's signed, and of course then the money is made available for implementation. But I think it's very important that you also know that after the grant making, what happens next. But in terms of influence, I would put this above accountability threshold, as really above accountability threshold. And last slide though, and just to flag that the process doesn't end with the grant cycle 7 process. You can move to the next slide. That once the resources and the funds are in, it's also about monitoring the implementation and holding the Global Fund and holding the CCMs and holding the governments accountable in terms of implementation to meet those targets that they had set. And so how do you do this? Through community-led monitoring, through a lot of consultations with the community, and maintaining robust engagement through CCM representation and all the other things that as advocates to really hold the implementation agencies to account. And so just sharing also the link to a lot of other additional resources that the O'Neill Institute has, and also Stop TB partnership that you can find. I think that this should be my last slide, and thanks a lot.
Thank you so much for that, Amanda. I'm going to ask some questions of Jen Furin, and also Celeste, ask you to read some of the questions that are in the Q&A specific to the Global Fund, directed to the Global Fund to respond. But first, Jen, this campaign is meant to be complementary with 146 by 2024. Can you tell us a little bit about that campaign and why some of what we've been calling the missing medical tools, that is TB-LAM, TPT, oral therapy for DRTB, are so incredibly important? Over to you, Jen.
Yeah, thank you so much, Sharon, and thanks to Celeste and Amanda and Luchika for the great presentations. I think that for me, when I think about these things, I really like the framework that starts the aims, which is ambition. I think that for way too long in the TB space, historically, we've really been stymied by very low ambitions, where we've said, let's just control it, let's do the minimum and see if we can get away with it. And the answer is we can't. Right, so having ambition is really important, but I think there's also a danger to having hollow ambition, or ambition that's not backed up by activity. Then it's about slogan making and promises, and those things also feel very disingenuous. And so I think what's exciting right now is we actually have the tools to achieve those ambitions. And we have a major donor, the donor that pays for much of the TB work that happens in the world, that says these tools are so important that we're willing to pay for this, right? And so what we need now is really a rallying cry. And that's what the 1x4x6x24 campaign is. I think, many of us remember the activism and advocacy that was done around HIV and antiretroviral therapy access that was catalyzed in some ways by the 3x5 campaign, which was the brainchild of many people, but including one who was my mentor, Paul Farmer, who this year, we're just this is we just passed 1 year anniversary of Paul's untimely passing, and so I think 146/24 is a rallying cry to say, get these tools out there, right? And these tools are amazing. We begged for them for so long in TB, and we finally have them, right? There's been a lot of talk about LAM. LAM is considered a rapid molecular diagnostic test. So, we can't always look to the funders and the donors to give us a recipe book, right? We have to say, this is what we need in our country. And we know that urine LAM it's a life-saving test shown in randomized controlled trials on a sample that's easy to obtain from most people, and actually acceptability work has been done. So urine LAM, put it in there. It's in there. Celeste told us, these ambitions are there. The TB preventive therapy, or what we really should call treatment of infection, because that's what we're doing, right? For a long time, we were asking people who didn't feel sick to take 6 to 9 months, or if you were living with HIV, 36 months or lifelong therapy. But we now have randomized control, high quality evidence and trials to show that a 1 month daily regimen, which is the one in the 1x4x6 campaign, or a once a week regimen for 12 weeks, right, saves lives. It reduces the risk that people are going to get sick. The 4 is fabulous for children, especially. Children are a population that's been systematically neglected in the TB space through deliberate decision making, right? Because it was thought they didn't transmit. So we owe it to children, right, to work harder for them. And there's other groups of neglected populations, like pregnant people, who've been left out. The 4 is fabulous. 4 is a 4-month regimen with drugs that countries already have in the country, right? For children with non-severe disease. So when we start hearing these arguments, oh, well, it's too hard to figure out if a kid has non-severe disease. No, the WHO recommendations are there. And this is based on a randomized controlled trial. The evidence is very high quality. And then we move to the 6th, right? The 6-month regimen just published in the New England Journal of Medicine, a high quality randomized controlled trial. These are great evidence bases showing that an all oral 6-month regimen with 4 drugs, right, is non-inferior. It's at least as good as the standard of care, and the standard of care is hard for people. I look at this esteemed panel, and many of us have been working on drug-resistant TB for our whole adult lives, and I didn't imagine I would see that. And so now we have to get these things to people, and that's where the 24 comes in. This can't be 10 years from now, or we hope. This is we have the tools to do this today. High quality evidence, right? And great studies. They don't need to be replicated over and over again in every country. So we have the ambition, and it doesn't have to be hollow. We have the tools, and we have donors saying, do this. So we have to do it. And I'll end sort of by saying, the engagement of civil society is crucial here. And I think Amanda laid out the many practical ways that this can be done. But I think all too often, policymakers and people who are treating TB, our hearts are in the right places, but sometimes we lose our way. And I remember having a conversation when we were trying to roll out bedaquiline, and it was hard. And I was having a conversation with a colleague named Busi Beko, who's a DRTB survivor. And I was trying to explain to her, I said, politically, this is very complicated. And she said, no, Jen, these are our lives that you're talking about. And that accountability, that honesty of being in the room and saying, this isn't just, a test, these are people's lives we're talking about. And so with that in mind, I think all of us can do more to advocate. These are great tools. The donors want to see us using them. The WHO recommends them. They're based on strong science. And we have a rallying cry, both with the A for the aims and ambition and the 146/24 campaign. So now is the time to act. And yeah, whatever I can do to support people, we're here and we're happy to do it. And so I'm going to stop talking now, and I hope people are inspired and motivated to action. And I'll turn it over back to you, Sharon Ann, and to let Celeste answer some of these questions. Thank you.
Thank you so much, Jen. So Celeste, over to you. You see the questions. Can you respond to them, and in your response, make clear what the question to you was? Thank you so much.
Sure. I think The first one is from David is asking about how can TV activists ensure that proposals to the fund address the needs of community health workers for remuneration plus protection from infection. So this can be added into the funding request. We have in the modular framework, which is how we the instructions for budgeting. If it's a community health worker that is going to be working in the 3 diseases, it will fall under human resources for health module. Or if it's a person that is working exclusively for TB, it falls under one of the TB modules, and it is covered there. Regarding personal protective equipment, it can also be budgeted. Regarding the other part of your question, when you're asking about the Global Fund's new key performance indicator for community system readiness, I know that there are new indicators for this, but I don't think I will be the most qualified person to answer to that. So I apologize for that. Then I see there are some about TB-LAM that we have already addressed them. Like I said, it is not a program essential, but it is a prioritized intervention. So I encourage everyone to please take a look at the TB information node. In the TB information node, you have the program essentials plus all the other prioritized interventions. Then here, you have a question here from Leila Lochting about the Global Fund allocation to TB at country level, that it's low, much less than 10% of the total grant, also in high burden countries. How is this justified from the side of the Global Fund? Well, this is as you know, the Global Fund allocations are calculated via an algorithm that takes into consideration the burden of the disease and then the economic situation of the country. There is more explanation in the Global Fund web page about how these calculations are reached. And then there is a part of qualitative adjustment. And I think I can share, I can type also the link to the Global Fund web page with all the explanations of how these calculations are made. That's what I know. Okay. Are there opportunities for affected communities to be trained on how to analyze some of these processes? I think this one's probably for Amanda, not for me. Then there's James has shared that for the Program Essential 13, there's a list of interventions pertaining to TB-CRG, and that is an area that has historically been underfunded. But now there are strong tools and evidence to help, and Stop TB Partnership has developed the following to help, which is, he sends there the link to prioritize TB-CRG interventions. So I think that there's no question there. And then there is John Polo Tuba is asking about the consultations for the baseline assessment for the country dialogue and how other countries can access this. Well, there are we are trying to see how to best support this. Some partners are providing support in other countries, and they are embedding this baseline assessment into other exercises that are already happening. For instance, some countries are doing the epi analysis or epi reviews previous to their program review, and they are doing it there. Other countries, what they are doing is, this is done by their NTP. We have just been working recently with a country that it's doing this, and it took them literally 8 hours to sit down and to create this baseline assessment, sitting with the person from the NTP. We are mobilizing some support for some countries that are requesting it. If this is the case, and you need special support, it could be engaged via the Global Fund or partners. So then you will have to reach to the Global Fund country team for that. That will be it, I guess.
Celeste, thank you so much for that. Amanda, can you look through the questions and see which ones you want to respond to? But in the meantime, while you're doing that, I just want to share my excuse me, but my very messy screen. So the fact that with the program essentials, the Global Fund has given us the guardrails in which to win, right? So as you saw from Celeste, she showed one example, and that is under the program essential of screening and diagnosis. Countries are required to include the baseline, so that baseline assessment. Where are we in 2022? Where we win is in terms of the ambitious, as you heard from Jen, and the measurable, as you heard from Amanda, targets that go into that column 2024, 2025, 2026. So these are both where we win the goals, which can hopefully mean more money, more implementation, but also where you win the accountability. Since both the CCM, civil society, and the Global Fund will try to hold the NTP to account. The NTP will need to report on the progress towards these percentages. For those of you that work on PEPFAR, for where HIV and TB overlap, which is in a lot of cases, obviously, and interventions here, we can also use these percentages to go to PEPFAR and say, look, okay, so we've applied for the Global Fund to take up this percentage, PEPFAR should take up the slack. So I want to say that we run towards this. We use this as the tool. And this is, again, just for the screening and diagnosis. But as you saw for the program essentials, it includes prevention as well. So what is the percentage year-on-year scale up, the coverage of TPT for general population? And as you heard from Celeste, there will be a toolkit of indicators that hopefully for TPT will include what is the coverage for household contacts? What is the coverage for people living with HIV? What is the coverage for general population? That's for prevention. Then you heard there's a program essential for treatment. So the indicators that we should receive in that toolkit are likely to include the coverage and access to child-friendly formulations for drug-sensitive and DRTB. You'll also hopefully see indicators and then fight for these year-on-year targets for 2024, 2025, and 2026 goals for scale up of oral DRTB treatment, that 6 months therapy that you heard from Jen that is so critical. And then, of course, for drug-sensitive TB, where countries are leaning towards the 4 months, which is fewer countries than the 6 months, to be clear. But this is where we can try to solidify. And I also want to encourage people to run past the allocation. Amanda mentioned the allocation letters. There are examples of CCM challenging that allocation. I know it's only possible for some countries, given that others are well into the negotiation. But as you heard from Amanda, it's also important to go past that allocation. And as you heard from Luchika, to be part of that unfunded quality demand. Because we've got a problem. We've got a problem with the ceiling in terms of the Global Fund stipulating that only 18% of overall Global Fund allocation can go towards TB. Now that percentage is held the same, even though treatment for drug-resistant TB changed radically, and it changed radically for the better. But with that improvement, it also became more expensive. That was not taken into account. Same with diagnostics. Diagnostics for the molecular testing, more cartridges became available, more new instruments became available, the cost has increased, and unfortunately that 18% ceiling still hangs above us. So you've got the low ambition, that floor that Jen Furin talked about. We need to work within the low floor and that high ceiling and bang that ceiling, break through that ceiling, so that the next cycle as well, we can certainly have more than just the measly 18% of the pie. Finally, and Luchika made this point, folks, she said run for the CCM. So not every CCM has gotten an election for new members, but let's make sure that there are TB allies and people affected by TB who are represented on that CCM. Now there is one country, I won't say who, but that has one of the highest numbers of people living with TB, people affected by TB. Guess how many TB constituents they have in the CCM representing TB? One, a little bit better than zero, Jen, but one. Now, how is one person that is supposed to reflect all of civil society and the priorities in terms of TB supposed to argue against those in the CCM that think that TB should not be receiving as much money? Or unfortunately, that conflict where people still don't see how that the fact that the number one killer of people living with HIV is TB, right? We're not going to be able to adequately fight HIV without TB. We need more than one. So let's run towards higher goals in terms of these coverage. Let's run past that allocation level and break that ceiling, and let's run for the CCM. I want to thank everybody, but first, Amanda, see if you have any closing remarks or responses to some of the questions. Now that I've tried to buy you some time, my friend.
Yeah, I think there was a question on how can communities also understand some of these processes, and maybe I can request James from Stop TB Partnership to share his email address in the chat, but also maybe it can be circulated to the folks that signed up for this webinar, and as well as colleagues from the O'Neill Institute. Just to say that Stop TB Partnership is supporting civil society engagement, but also the Global Fund has a lot of tools and resources, and really get excited about, exploring the website. I think there's a lot of information there. There's a lot of briefs that are available online in terms of supporting you, engaging, but also, yeah, just how you can improve your overall understanding of the Global Fund and how to engage, but also influence successfully. So there is support, there is resources available in terms of tools and a lot of information as well that's there.
Let me, VRL is on the panel. James, your email address is going to be put into the chat for everyone. But VRL, I want to ask you to respond to the request for more information, more help, more guidance, because Stop TB Partnership has so successfully been the conduit for affected communities and civil society to be able to impact these various initiatives, including the Global Fund proposals. Thank you, VRL.
Yes, thanks. I appreciate very much, and congratulations with great discussions and a lot of information to digest. Right? Yeah, definitely. I mean, please do not hesitate to contact us, because during last probably 3 or 4 years, we spent quite a lot of effort together with all our partners from the Challenge Facility for Civil Society to put together an impressive list of we call them investment packages. So basically you can use these investment packages as they are and include them directly into the proposals to the Global Fund. So they are like in the form of templates attached with the budgets and so on. So please visit our webpage, and you will see there a lot of investment packages. But one is included by was included by James in the Q&A chat. That link basically congregates all the tools that we have together for this specific grant cycle 7 that we discussed. Using the opportunity for the last minute, probably I would like to reflect a little bit on 2 things. First, essentials. I understand that Global Fund is cautious in terms of like saying that we cannot cover, and it's okay. They cannot cover everything and totally. But I would leave this to native English speakers. Essential for me is it should be there. It's like either essential or non-essential. These are not priority interventions that should be prioritized, and some priorities can be included in unfunded quality demand. Essentials should be there. They either covered by the Global Fund or by domestic sources or by other donor, but they are essentials. As soon as they are essentials, they should be there. They cannot be included in a gap. Yeah, so that's first to understand, and there are a lot of essentials that are covered by the community rights and gender part, which is elaborated by us for specific application to the grant cycle 7. Second part, with the essentials, problems are not that they are there. Majority are included because we are knowledgeable, and the writers, the teams are knowledgeable, and they include them. The problem is ambitious, and I would like to agree with Jennifer here. It's like it's ambitious. We need to be ambitious in order to. It's not that we need to scale up the rapid molecular testing. It's we want to replace the microscope, which is coming from 18th century. That's another way to do. And we are here a lot of people who are advocates. And basically what we are saying, let's go back and advocate. It's right now. The country dialogues are happening right now as we speak. We should close this call and go and start working with those teams that are on the ground right now and putting proposals already. The drafts are already discussed by partners, by technical agencies and so on. So please, if you need any other support from us, don't hesitate. You said that you will include James there, poor James. You can include me as well. So please reach out and we will do our best to support in any way. Thanks and congrats, Sharonan and team. Great job. Thank you very much. Back to you.
Thank you so much. I just asked my colleague to make sure that VRL's email address is put into the chat. So don't hang up yet, so you can grab that and he could be your first stop for all requests. Okay, good. That's there. So now I just want to say thank you to everyone. Thank you to Celeste, to Luchika, to VRL, to Jen and Amanda, and all of you that are currently engaging in your CCMs. We will talk to Stop TB Partnership and Global Fund to see if we can organize a French version of this and to see if we can drill down further. If not, we did provide the French info note, the Spanish info note in that link that I sent. You could also find that on the Global Fund website. And I just want to say the program essentials, again, is how we win, because even if the proposals do not reflect everything in terms of where we want to go for scale up of prevention, testing, and treatment, it's at least a way to keep government accountable and to push for more. So thanks, Global Fund, for pushing for those program essentials. Next time, we better see some TB Lamb on there, but thank you and good luck, everybody. Bye-bye. Bye.